progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Hyperthermic intraperitoneal chemotherapy is one of the most innovative treatments available, and combining this treatment with robotics technology may give you the edge you're looking for. My guest today is Dr. Joongho Shin. He's a member of the medical staff at Palmdale Regional Medical Center, as well as a member of the medical staff at Keck Medicine of USC. Welcome to the show, Dr. Shin. Tell us a little bit about HIPEC and who is it used for?
Thank you for having me, Melanie. The HIPEC is a hyperthermic intraperitoneal chemotherapy. It is used for the peritoneal metastasis of colon cancer and, to a lesser extent, ovarian cancer and a gastric cancer. I'm a colorectal surgeon, so I mainly use it for patients who had cancer spread from the appendiceal cancer and the colon cancer to the peritoneum.
So how does this innovative treatment work, and when would you decide that a patient needs this?
So typically, patient had already had a surgery for the colon cancer, and a few years later, they found out that their cancer recurred within the peritoneum, which is about a cavity of the body, of abdomen. And they typically undergoes a period of systemic chemotherapy. And we carefully evaluate whether or not the patient will benefit from these procedures. And the most important part of this procedure is the cytoreduction. All the research and experience has shown that the most important indicators of a long-term success is whether or not complete cytoreduction right before the HIPEC can be achieved.
So how does it work? It's absolutely fascinating. Tell us a little bit about how it works.
So once we achieve a complete cytoreduction, whether it's taking out an organ or a portion of the tumor within the peritoneum, we insert two catheters, inflow and outflow, and there is a special circuit that heats up the chemotherapeutic agent to 43 degrees, and they constantly circulate the abdominal cavity for 90 minutes. And the heated part also makes the penetrations of a chemotherapeutic agent deeper into the peritoneum and helps to achieve a better delivery of the chemotherapy.
Tell us some of the advantages of HIPEC.
So for the peritoneal disease of the colon or appendiceal cancer, the systemic chemotherapy, the effectiveness is limited, and that's where the HIPEC comes in.
So is this allowing for higher doses of chemotherapy? What does it do for the patient?
Yes. So the chemotherapy agent that is used in the HIPEC is slightly different from the systemic chemotherapy. We typically use a mitomycin and also use a 5-FU-DR. And so these agents are directly in contact with the peritoneal surface and then any residual tumors. So the delivery is better, and also the heating part also makes the toxicity of the chemotherapeutic agent can be increased.
So how does it affect the rest of the body's exposure to chemotherapy?
Less than what you think, because it only penetrates about less than 2 millimeters of the peritoneal surface. The systemic absorption is fairly low. However, this procedure is not without its risk. There is a risk of to the lungs, kidneys, and the bowel, and the patient's recovery can be prolonged. That's why it's crucial to have a preoperative evaluations whether or not the patient is the best candidate for the HIPEC. We usually for every 5 patients, probably 1 or 2 patients will be the candidate for the HIPEC.
So you mentioned the cytoreductive surgery. Explain how the robotic surgery and HIPEC work together.
Actually, the robotics is separate from the cytoreduction and the HIPEC. Robotic surgery is the new technology that allows a precise dissections within a small confined space, such as a pelvis. So in colorectal surgery, it is best to be used on the rectal cancer surgery.
Okay, so then what would be the benefits for the patient? What happens after this particular procedure?
So the robotic surgery, the benefit of robotic surgery is a minimally invasive. So the length of the cutting on the muscle, abdominal wall muscle, is minimized. So the patient's postoperative pain can be much smaller, and the recovery could be faster. That's one benefit. The other benefit is the robotic instrument and the visualization itself allows the surgeons to precisely dissect within the very narrow pelvis to achieve the best oncologic outcome.
And what about for HIPEC? What are some of the benefits for the patient? What is their recovery like?
Okay. The HIPEC, the recovery from the HIPEC procedure depends on the extent of the cytoreduction and also the patient's age and comorbidities. In general, the patient can expect to stay in the hospital up to 1 to 2 weeks. But overall, if the patient is well evaluated and deemed to be a good candidate for the HIPEC, the procedure itself can be done safely.
And in just the last few minutes, Dr. Shin, what should people with colorectal cancer be thinking about when they're seeking care?
The first thing is the multidisciplinary care, especially in the rectal cancer. The rectal cancer, both rectal cancer and colon cancer, is a highly curable disease, especially at the early stage. And in rectal cancer, it's important that the patient see a medical oncologist, radiation oncologist, and surgeon at the same time before any of the treatment is started, and come up with the best plan for the treatment algorithm.
And why should they come to Palmdale Regional Medical Center for their care?
So Palmdale Medical Center has experts from Palmdale Regional Medical Center itself, as well as a USC Keck Medical Center, and they can provide a multidisciplinary care for the complex rectal cancer care so that the patient can achieve the best outcome.
Thank you so much for being with us today, Dr. Shin. It's absolutely fascinating. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.